Good morning, Miss Adams. How are you feeling today?
To be honest, not great. I was told yesterday that I have tuberculosis, and I'm really scared. I don't even fully understand what it means.
I completely understand how worrying that must feel. It's perfectly normal to be anxious after hearing that kind of news. Would you like me to explain a bit more about tuberculosis and what happens next?
Yes, please. I'd really appreciate that.
Of course, tuberculosis, or TB, is a bacterial infection that mainly affects the lungs. It's caused by a germ called Mycobacterium tuberculosis. The good news is that it's treatable and curable with the right antibiotics. You're in the right place, and we'll make sure you get the best possible care.
So, it's not always fatal?
Not at all. Years ago, before modern medicine, it was more dangerous, but nowadays, with proper medication, most people recover completely. It just takes some time and careful treatment.
That's a relief to hear. But why do I have to stay in this isolation room? It makes me feel like I've done something wrong.
I can understand that, and I'm really sorry it feels that way. The isolation isn't a punishment, it's simply a safety measure. TB bacteria can spread through tiny droplets when someone coughs, sneezes, or even talks. So we keep patients in a special room with good ventilation until the treatment starts working and the infection is no longer contagious.
How long will I have to stay here?
Usually, patients stay in isolation for about 2 weeks, but it can vary depending on how you respond to the medication. We'll check your progress regularly, and as soon as it's safe, you'll be able to move out of isolation.
Okay. And what about the treatment itself? What do I have to take?
You'll be given a combination of antibiotics, typically 4 different medications at first. The treatment usually lasts 6 months in total. You'll need to take the tablets every day, even if you start feeling better after a few weeks.
6 months sounds like a long time. What happens if I forget to take them sometimes?
That's a really important question. TB bacteria can become resistant to medication if the treatment isn't taken correctly. That means the infection could come back and be harder to treat. So, taking your medicine exactly as prescribed is essential for a full recovery. Don't worry, we'll support you with reminders and regular follow ups to make it easier.
All right. Will I still be contagious during that whole time?
No, not for the whole period. Usually, after 2 to 3 weeks of treatment, you'll no longer be contagious. But we'll confirm that through follow up tests before lifting precautions.
Can I see my family while I'm here? My wife wants to visit.
Yes, she can visit, but we'll ask her to wear a surgical mask and keep visits short until you're cleared. It's mainly to protect her from any possible exposure in these early days. You can also call or video chat as often as you like. Staying emotionally connected is very important for recovery.
That's good. I was worried people would start avoiding me once they hear about it.
That's a very understandable concern. Unfortunately, there are still a lot of misconceptions about TB, but please remember it's an infection like many others, and with treatment, it goes away. You haven't done anything wrong, and there's absolutely no shame in it.
Thanks. That helps. Are there any precautions I should take myself right now?
Yes, a few simple ones. Always cover your mouth and nose with a tissue when you cough or sneeze, and dispose of the tissue safely. Wear your mask whenever anyone comes into the room. Try to keep the room well ventilated. That helps prevent the bacteria from staying in the air. And of course, keep taking your medication on schedule.
Got it. Can I go back to work soon?
It depends on your job. Once your doctor confirms you're no longer infectious, you can return to normal activities, provided you're feeling strong enough. Some patients work part time from home during treatment. We'll discuss a return to work plan later on.
Okay. I just don't want to be a burden to anyone.
You're not a burden at all, Ms. Adams. You're taking the right steps to get better and protect others. That's very responsible, and you're not alone in this. Our team will monitor your progress, support you with medication, and check your lung function regularly.
That's reassuring. What about side effects from the medicine?
Good question. Some people may feel mild nausea or notice their urine turning orange. That's harmless and expected with one of the drugs. But if you have severe symptoms like vision changes, yellowing of the eyes, or numbness, tell us right away. We'll review your medication if needed.
All right, I'll keep that in mind.
Excellent. You're doing really well. taking this all in. I know it's a lot of information, but you're asking all the right questions.
Thank you, nurse. I already feel much calmer.
I'm glad to hear that. Remember, TB is fully curable and you're in safe hands. With consistent treatment and support, you'll be back to your normal life in a few months.
That gives me hope. Thank you for taking the time to explain everything.
You're very welcome, Miss Adams. I'll check on you again later today. If you think of any other questions or concerns, just press the call button.
I will. Thanks again, nurse.
My pleasure. Take care and get some rest now.